Any other sort of big things that people should know or test? I mean, things like magnesium or, looking at oxidative stress, HSCRP. You see, from a preventative model, I'm just really, and I know it's not absolutely definitive, but I look at 10 sort of functional medicine tests, or just from a physical perspective. And obviously the emotions affect those numbers as well. T3 to reverse T3 ratio, these type of things. Anything that's important that you've seen in your career that is really, really important to try and prevent this disease?
I think understanding that we're water and really
Mm,
getting a grasp of what that means. And then, there are inputs that were designed and I think so this is the thing, is not just one thing. So this is a lot of people are like, tell me the one thing, like what was the one thing that caused my cancer? It's like there's not one thing. It's
mm,
how we're living our lives. And for each person, it's different. And I will say, I have, patients who have the same disease, but the reason why they're sick is different. One of them, it's an emotional thing. Someone else, it's, their diet. Another person, it's the lifestyle that they're living. And so for me, um, it's really helping bring people back into balance, and their story is going to reveal to me what it is that's caused this. And I think the other thing is that in Western medicine I did so much testing, and for me, when I was so heavily focused on the testing, I lose sight of the whole
mm,
being. And my particular practice happens to be much more focused on, because there are a lot of other doctors in the space who are doing functional medicine, doing all the testing, but there aren't a lot who are talking about the emotional impacts and also the diet of like bringing this together with, how do we teach people how to release past trauma without re-traumatizing themselves, like sometimes can happen through therapy? And then how do we teach them how to eat to support their body? And what one of my clients' needs could be completely different than someone else. One person could be doing vegan and another doing keto, but as long as you're, looking at their GKI and getting them so that they're, from a metabolic standpoint, getting healthier and improving their mitochondrial function. So for me, it's much more of this holistic. And I will say that a lot of my practice comes down to diet, water and fasting, and then emotional and mental work to really just, and really it's more, one of the things that I find is that at least in my practice, that people are overwhelmed with all of the tests, and then how are you putting it together? And for me, I'm wanting to simplify things. There's so many different things that you can do, that I teach them the foundations of, okay, these are the natural things that you can do to flip the switch to detoxify your body, which cancer is a detoxification problem. We need to detoxify it. It could be like chemical toxins in their body, it could also be emotional or mental
mm.
toxins as well. But how do we balance that detoxification and then learning how to nourish your body? And so I tend to take this more kind of balanced approach, and also to help calm people down. Because when you're all of a sudden looking at all these tests, and for me, my clients are overwhelmed,
Yeah.
and I'm wanting to bring it back and help them understand this is how your body works. And you know what? The fact that you got cancer is not your body failing you. Your body is showing you there's a problem with the way that you're living. And so it's more of that. Like that's the approach that I take. And this comes from being in the space for 20 years, dealing with people with cancer. They are afraid. And part of my job is to teach them your body hasn't failed you. Your body is doing exactly what it's designed to do. So let's start to work with it. What is it showing you? What are these pieces? And just having the understanding that there's this whole, holistic approach to healing and becoming whole. It just has a different feeling for people that can give them something. And then, you know, I work with naturopaths, I work with other functional medicine doctors for these other pieces, but for me, I'm more
Mm.
teaching the foundation, you know, of like, what does balance look like? How do we pull the levers that we can use, like water fasting? I had Lauren Lockman was just on my podcast this week talking about prolonged water fasting. And I can tell you that if I was diagnosed with cancer today, I would immediately go into ketosis and then I would water fast for probably 30 days.